Hey, we had agreed to tape this today for our fellow members of Southgate Rotary of England, so they can get the benefit of this information since they did a project with us at the same time. So I want to cover some things, and some of you already know, but it's really for the benefit of the Southgate Rotary of England. Rotary International President Don Kurn has challenged all clubs this year to curb child mortality through the provision of basic needs projects for children. Last year he said that every child deserves a chance for a healthy life. Unfortunately, every day some 30,000 children under the age of 5 die from preventable causes. And when I first learned of this statistic, he says, I thought that surely there had been a mistake, that the number was an error. And unfortunately, it was not. That every day throughout the world, children die needlessly of pneumonia, measles, and malaria. Thousands die every day from the lack of a most basic resource, clean water. And many more die from a combination of factors in which malnutrition and poverty play major roles. Well, the Southgate Rotary Club of Michigan decided to use its locally raised funds to collect and distribute diapers and formula to impoverished families. Infant mortality in Wayne County, the area in which we live, has not improved from 2000 to 2005 according to recent statistics. Consulting with staff from the Guidance Center, we learned that Rotarians can do something very simple to impact this problem in this area, and that is to provide free access to diapers and formula for families. And why is this important? Well, lately with our economy, parents are, without these resources, are sometimes using diapers longer than they should, or watered down the formula in an effort to make it last longer, which is actually bad for children, bad for infants. Both actions significantly increase health problems for the infant. Club assemblies were held by our club to discuss the project and plan the work involving many members of our club. Club members worked at charity poker fundraisers, setting aside $1,000 to purchase disposable diapers and formula for distribution to the Guidance Center. In addition, Rotarians set up and collected donated diapers and formula from local citizens from collection centers at the Guidance Center, the Downriver Community Conference, the Downriver YMCA, and Southgate Holiday Inn. You see some of the materials right here that may have been collected. Announcements were made to the public, and the Lincoln Park Rotary Club and private citizens donated an additional $400 for this project. One member was able to negotiate a good price, thank you, John, and a donation of $150 for the diapers formula with Kroger's in Southgate. Kroger's will be our delivery point. We're going to be picking it up from them next week.
Great.
In total, $1,550 was raised to fund this effort. The Guidance Center will distribute the donated diapers and formula throughout their family resource centers. There are 7 of them that serve this Downriver area. Aaron Graham is here today from them to talk about how they're going to do that, why that's very important. These centers provide families throughout the 18 cities of the Downriver area with a resource library, parent-child play groups, parent interest groups, infant massage classes, and workshops. And in addition, the Guidance Center provides programs that promote healthy, nurturing families through services for first-time parents that include home visits and developmental services, as well as parent support and education. Southgate Rotary will be presenting the donation of the diapers today, as you see, and also next week when we drop off the materials we receive from Kroger's. The Guidance Center staff will present information regarding infant mortality today at this meeting. About a year and a half ago, Southgate Rotary Club was electronically pinged by the Southgate Rotary Club of England. They actually Googled our name, found us, and I think they really wanted our website name is what it was. Anyway, we decided to share club bulletins and information back and forth. And we decided it would be a good idea for us to ask them to join us in this effort. So we sent over $500 US dollars through a wire transfer to England, and it was presented ceremoniously to the Southgate Rotary Club of England along with a certificate celebrating the collaboration and a club banner by Jamie Treadwell, who's a friend of our club. This was done on March 9, 2009. Present at their meeting was their district governor of the Greater London area, Wally Daly, along with the Deputy Mayor, Councilor Anne Marie Pierce, and a local member of the Parliament, David Burrows. The invitation from Southgate Michigan Rotary Club to collaborate on this project simultaneously prompted the Southgate Rotary Club of England to look again at their local community needs. At first, they could not imagine that there would be a need such as that to curb child mortality in their area. They were greatly surprised to find out that there's a need indeed present, and that organizations seeking to work with these families and young mothers did need financial support for educating young mothers on infant care and providing basic safety items. The Rotary Club of England identified 2 community agencies for their collaboration in this project, the Children and Young People Health Visiting Service and the Young Parents Project, both of whom work with a diverse population of children aged 0 to 5 and their families during the ante and postnatal stages of life for an infant. So today we have Aaron Graham from the Human Resource Center and the Guidance Center coming up to talk to us about what they do. Aaron, come on up.
On behalf of all the families that I work with, I just want to say thank you to all of you for bringing us these diapers and formula. We have, as Ron said, 7 sites that we operate out of, spread all around downriver. We have about 230 children coming through. That's birth through 5-year-old children. We don't count the older ones because they don't fit into our billing. So you can imagine that they do come with siblings. And many of those children are young and do need the diapers and formula. We have over 100 parent-child interaction groups each month, over 30 story times. The infant massage, we also have GED and workshops, and parents are coming to us. Now word is starting to spread throughout the guidance center, so we're having people come from workforce development and other programs looking for supplies for their babies. And the last few months we've had to turn people away. So I'm just speechless with how great this is to actually have supplies and to be restocked and to be able to give families what they need. So thank you very much.
Nice job, Amy.